If you're reading this, there's a good chance your feet feel like they're perpetually walking on a bed of hot coals, or perhaps they've gone completely AWOL, replaced by a dull, buzzing numbness that makes balancing feel like a high wire act. Welcome to the world of peripheral neuropathy, a condition that affects millions but is often handled by the traditional medical establishment with a shrug and a prescription for a pill that makes you feel like a zombie. I'm Dr. Mark Dailey, and at Oneonta Spine and Laser, we like to do things a little differently. We're not big fans of the just live with it approach. Today, I'm pulling back the curtain on why your current treatment might be failing and revealing the secret that high-end clinics use to actually move the needle on nerve pain. This is the class 4 robotic laser therapy. Let's be real for a second. Most people diagnosed with neuropathy are told it's a progressive and irreversible condition. They're handed a script for gabapentin or Lyrica and sent on their way. While those drugs can certainly dull the pain and sometimes your personality, they don't actually fix anything. They're essentially the medical equivalent of turning up the radio so you don't hear the engine knocking in your car. Eventually, the engine is going to blow. The secret that many experts fail to mention, either because they don't have the technology or they're stuck in the 1995s, is that nerves can heal if you give them the right environment. They need a little help getting their internal machinery running again. That's where the high tech stuff comes in. So you might have heard of cold lasers or low level laser therapy. They've been around for a while, and while they're okay for minor issues, they're often like bringing a squirt gun to a house fire when it comes to deep-seated nerve damage. At Aniana Spine and Laser, we use a class 4 robotic laser therapy. This isn't your average pointer finger laser. This is a high-powered precision guided system designed to penetrate deep into the tissues to reach the nerves that are actually screaming for help. So, how does a beam of light fix a dying nerve? It's a process called photobiomodulation. Essentially, the laser light travels through the skin and is absorbed by the mitochondria, which is the powerhouse of your cells. This absorption triggers a cascade of biological events. It increases ATP production. It gives your cells a massive boost in energy, allowing them to repair themselves faster. It improves circulation. That means it opens up tiny blood vessels or capillaries that feed your nerves. Neuropathy is often a starvation issue. The nerves aren't getting enough oxygen or nutrients. The laser brings the nutrients back to the nerves. It also reduces inflammation. It flushes out the inflammatory chemicals that keep you in a state of constant pain. Nerve regeneration. Research shows that specific wavelengths of light can actually stimulate nerve conduction velocity and help regrow the protective myelin sheath, which is like the rubber around a power cord around your nerve. I know what you're thinking. Dr. Daly, it sounds too good to be true. Is this science or science fiction? Well, the clinical evidence is really staggering. In one study focusing on type 2 diabetics with peripheral neuropathy, patients saw their pain levels drop from a 6.47 down to a 1.21 on a scale of 1 to 10 after just 10 days of treatments. That's a life changing difference. Another review of the class 4 laser therapy reported an effective rate of 90% in clinical trials with zero observed complications. So imagine having a 90% chance of getting your life back without surgery or addictive medications. That's why we've been investing so heavily in this technology at our clinic. I want you to notice that we call it robotic laser therapy. Most class 4 lasers are handheld. The doctor or technician waves it over your skin. They're like painting a wall. Problem? Human error. They move too fast, the dose is too low. If they stay in one spot too long, it gets hot. Our robotic system at Oneonta Spine and Laser removes the guesswork. It scans the area and delivers a perfectly consistent therapeutic dose every single time. It's hands-free, non-invasive, and incredibly precise. You just lay back, put on some cool safety goggles, and let the photons do the heavy lifting. People ask, is it safe? Does it hurt? Well, one of the best secrets about laser therapy is how incredibly boring the treatment actually is. You don't feel a thing, maybe slight soothing warmth at most. There are no side effects. You don't have to worry about liver damage, brain fog, or dizziness like you do with neuropathy medications. Sessions usually take less than 30 minutes. Most of our patients use the time to catch up on a podcast or even take a quick nap. You can walk right out of our office and go about your day immediately afterwards. So, if you want more details on that offer, we have two options. You can simply call our office, and the number will be here available, 205-625-3488, or you can take our neuropathy severity survey, and there should be a link on this page that you can click. It's just an online questionnaire, and it gives us an idea how severe your neuropathy is. While the laser is the superstar of our neuropathy protocol, we don't stop there. Nerves are finicky. They need the right fuel. That's why we often combine our laser treatments with lifestyle and nutritional changes, and sometimes functional medicine to ensure your body has the raw materials it needs to rebuild those damaged pathways. If your neuropathy is tied to spinal issues like a pinched nerve in the lower back, mimicking foot pain, we can use our 3D spine stimulator to show you exactly where the communication breakdown happens. The biggest secret of all, you don't have to wait until you can't feel your feet at all to seek help. In fact, the earlier you start, the better the results. If you've been told there's nothing else that can be done, you haven't been to Aniana Spine and Laser. We aren't interested in just making your symptoms go away. We want to help you get back to walking the dog, playing with the grandkids, and living a life that isn't dictated by nerve pain. Don't let another day go by with that pins and needles feeling. It's time to find out if you're a candidate for the most advanced neuropathy treatment available in our area. Jump to the head of the line by calling our office directly or take our neuropathy severity survey. I hope this has been helpful to you. Thank you so much. God bless you.